What was your recovery like after the procedure?
The first thing that came back for me was speech. That was what started to come back first. Starting with stuff like counting to 10. I actually have a pretty funny story about that. So we counting to 10, and for some reason, those first few times I counted to 10, when I got to 7, I slipped into Spanish. and I was a C student in high school in Spanish. So, like, I am not by no means a Spanish speaker. But no, I was literally going like 6, 7, and like, yeah, for those first few days. And then from there, it's like a train down your body. Like, starts with the shoulder and then go down, motor skills, fingertips, everything.
You made a full recovery?
Yeah.
Great. And I can't believe, or I imagine how happy your mom was after everything she saw you go through to see you getting better. Really quickly for the viewership, most strokes, especially as we talked about earlier, you think of them in older individuals. That develops over time, something known as cerebrovascular disease. It can create a blockage that blocks blood flow to important parts of the brain. That's a very common cause. Sawyer had a unique case, and these things are what you got to think about in young people who present with stroke-like symptoms. Sawyer had literally a hole in his heart that allowed basically what in medicine we call an embolus to get through his heart, go in his bloodstream, and it was an acute blockage in his brain. And I know that, along with, in some cases, these dissections in the vessels can cause these acute symptoms in young adults. Dr. Marcus, what do you tell your patients when you say time is brain in terms of what are the most acute signs people should look for?
For young people, it's not just the diabetes and hypertension and high cholesterol, that there are congenital problems in the heart, there are genetic predispositions to forming blood clots that people walk around with every day. But I think what's important is recognizing the signs and symptoms of a stroke. I think what Sawyer's mom was able to do for him was heroic, right? Get him to the right hospital as quickly as possible and essentially get him the treatment that saved his life. And we try and teach people out there that the symptoms of the acronym FAST, so face, facial weakness, arm, A standing for arm weakness, S standing for speech difficulty, and T means time to call 911. And Sawyer had all 3 of those symptoms, and his mom called 911 effectively.
Sawyer, we're so happy that you're fully recovered. Dr. Marcus, keep up the great work. And if you think you're having a stroke, call 911.